post-immunization effect, or it called KIPI. Many people don't want to get vaccinated. We as prospective public health graduates, as agent of change, health educators, what should we do next as an effective way to get people to get vaccinated? Thank you.
Okay, can I answer? Okay, maybe I will answer the question. It's a very great question. Here, in our study, the result is model of peer educator among young people is a potential strategy to give the information, so we can I mean that we can spread the truth of information about vaccine. Actually, like as you mentioned that KIPI, yeah, because there is a different result if we got vaccinated from like Sinovac or AstraZeneca, because I will compare with the AstraZeneca. AstraZeneca is very strong, so usually if after get vaccinated with the AstraZeneca, the result will be more heavy than other vaccine. So if we because we cannot maintain that which one is the vaccine that will be used by the community, so we need to give many information, and as a public health and also student is also the agent of change, we can contribute with the give the education to the community. And I think for the government, maybe we can make like peer educator trainings for this for the young people, and young people will spread the information to the community. So the concept of the peer educator, I think it's very important to give the contribution to contribute for the effectiveness of the program of the vaccination to the country. Maybe it's the one that I think is very important as a public health educator, and also for the as well as you are as young people to spread the as many as much as information that we can give the correct information to the community. Thank you.
Thank you so much, ma'am, for the answer.
Okay, thank you very much, Mrs. Raihana and Mrs. Silva Kamara. So, how Miss Silva Kamara? Is it clear?
Oh, is it so great? Thank you.
Okay, thank you, Mrs. Silva Kamara. Okay, next, ladies and gentlemen, any question for Mrs. Raihana? Okay, well, if there is no question again to Mrs. Raihana, so I will close this question and answer session. So before I close, I want to read a conclusion for this first discussion session. So I conclude that in this challenge and opportunity in COVID-19, so the younger generation must be able to choose which news about COVID-19 is true and which is not from social media. So it means the younger generation is very crucial in this pandemic era to choose the best news, like which one is the true news about vaccine and etc. Okay, thank you very much, Mrs. Raihana, for joining us. And we hope we will meet in other occasion, but before it, we will take a photo session, yeah, Mrs. Raihana. Okay, please, for the committee to take a place for photo sessions with all the participants and with our first speaker, Mrs. Raihana. So please, all participants, open your camera because now we will get a photo session with Mrs. Raihana. Okay, Brother Ajis, is it clear? Okay. One, two, and three. Okay, it's done. Okay, ladies and gentlemen, it is done for photo session. Thank you very much, Mrs. Raihana. Okay, this Mrs. Raihana, if you have any activity, you can leave this Zoom meeting. Thank you very much. Okay, well, ladies and gentlemen, we will continue our session. And before we continue the second speaker, I will tell you that now we will take a coffee break. So if you want to drink or eat some meal, so please you can do that. And we also moving to our next session with our second speaker. Well, ladies and gentlemen, moving right along, we will continue our discussion with our second speaker, Mr. Jericho Pardosi, PhD. But before I would like to introduce Mr. Jericho Paradosi, PhD, to all of you. So I will read his CV for you. Okay, our second speaker's name is Mr. Jericho Franciscus Bardosi, PhD. He was born in Jakarta on 21 October 1980, and his position now is a lecturer in Queensland's University of Technology, and his address is in 149 Victoria Park, Calvin Grove. And then his email address you can see on the screen. And then for his education in 2001, he have the diploma in Environmental Health Academic Ministry of Health. And then in 2007, he had bachelor in University of Indonesia, especially in public health epidemiology. And then in 2010, he did master in University of Queensland, especially in international public health. And then in 2016, he did PhD in Macquarie University, especially in health demography. And then for his relevant experience in 2019 until now is a lecturer in the School of Public Health and Social Work, Queensland University of Technology. And then in 2015 until 2019, he is an associate lecturer, School of Public Health and Community Medicine in University of New South Wales, Sydney, Australia. And then for his publication, uh, and first entitled is Evaluation of the Indonesian Early Warning Alert and Response System in West Papua, Indonesia. And second is Sexual Intercourse and its Correlates Among School-Age Adolescents in Indonesia, analysis of the 2015 Global School-Based Health Survey. And then third, there's entitled Answering Healthy Lives, Saving Life at Birth in Indonesia, and then etc. You can see on the screen how many publications he has. And then for Grand Reserve, title of study is Using Board Game for Improving Mental Health Literacy Among Young Pacifica in Queensland and Indonesia in West Java. And he is as principal investigator. And then second, Janger or Jangan Rabies, a community-based approach to support health promotion in Bali province. And he has as a CO investigator and etc. You can see about his grand receipt. And then for current research, first, the title is Women's and Health Monitoring Experiences on Maternal and Child Health Service from Pregnancy to Postnatal Periods in Indonesia, a systematic review, and etc. And for honors and awards, first, he had International Macquarie University Research Excellence Scholarship, Faculty of Business and Economics, Macquarie University, Sydney, Australia, in 2012. And second, the University of Queensland Indonesian Alumni Awards in the University of Queensland, Brisbane, Australia in 2010. Wow, super. So, also, ladies and gentlemen, you can wait to get information and education from him. So please welcome Mr. Jericho. Time is yours.
Thank you so much. Can you hear my audio? Is it clear enough? Can you all hear my audio?
Yes.
Yep. Before I start, could I ask some of the participants to mute your audio, because I think many of you still using your audio. It will be very hard if you still unmute that one. Can you everyone make sure that you mute your audio? Much appreciated. Thank you so much for this wonderful opportunity. Thank you so much for the rector, for the dean, and all the deans, and also the lectures in Universitas in UIN Medan. Let me start my presentation. Can everyone see this one? Okay, I might just start this one. So once again, thank you for this wonderful opportunity. My name is Jericho Franciscus Pardosi. Many of you are probably familiar. Oh, Pardosi. So you're coming from North Sumatra. Yep. Both of my parents coming from North Sumatra. My dad is coming from Balige, and my mother is coming from Samosir Island. So I'm Indonesian, but at the moment I teach at the School of Public Health and Social Work at QUT Brisbane, Australia. So today we'll be focusing more about understanding women's health and triple burden during the COVID-19 pandemic. Now, first of all, I would like to acknowledge the Turrbal and Yagara as the First Nation owners of the land where I now stand, where I work. I pay respect to their elders, laws, customs, and creation spirit. And I recognize that this beautiful land have always been places of teaching, research, and learning. I also like to acknowledge the important role Aboriginal and Torres Strait Islander people play within the QUT community. So just an outline for today's presentations. I'll try my best to complete this presentation in the next half an hour. Introductions, some of the rationales. Why do we need to care for women's? In terms of women health status, what is the state of women health and well-being during this COVID-19 pandemic, or even prior to this global pandemic situation? What do we mean by triple roles and the delays framework, and what will be the future implications? So if you're wondering, like, why do we have a specific sessions trying to understand women's triple roles or triple burden during this COVID pandemic? Well, you can read stuff, but I just want to highlight that many women in low and middle income countries, or LMICs, do not receive adequate healthcare services. They have difficulty just to access the closest healthcare services. At the same time, many women and girls, I also include girls here, have chronic and disabling conditions. In the next few slides, I'll explain to you what I mean by many women have chronic and disabling conditions. Because unfortunately, non-communicable disease, or also known as chronic disease, considered as the cause of death for many women, regardless wherever you live, whether you are in high income countries or low or in middle income countries. Tragically, many women and girls still experience all types of violence, sexual abuse, verbal abuse, domestic by their intimate partner or by husbands. And women are more likely to be poor and uninsured in terms of difficulty and barrier just to access the healthcare services. Now, if you are a woman or a girl having difficulty just to seek the best healthcare, just to seek or to access the healthcare services in your region or in your cities, then it is more likely that you will lack adequate knowledge in terms of health and ways to protect yourself. Now, sadly, all those things listed at the above is because women do not have equal participation in decision, especially if you are living in a strong patriarchal community or society where male dominate the whole decision making. So which means many women and girls are still left behind, being neglected, unprioritized, and more tragically forgotten in terms of health policy. Now, just to remind everyone that we are still living in the Sustainable Development Goals era. We have finished the Millennium Development Goals, and now we are trying to meet the 17 Sustainable Development Goals. Now, each goal has its connections to goal number 3, and that is the good health and well-being. For this particular presentations, I would like you to concentrate on 2 main goals, and that is goal number 3, good health and well-being, and goal number 5, gender equality. As I written there, the 5th SDG goal focuses on ways, how do we achieve gender equality by making sure that women, regardless whether they are poor, whether they are rich, regardless their position in the society, regardless whether you support the political views, whether you support the government or not, or regardless your cultural and religious background, we still give greater participation for them in order for them to improve their health and well-being. Now, if you're not aware, let me give you a comparison in terms of the demographic overview of a female. This is at the global settings. So total populations of female, 3.843 billion based on the 2020 data, as compared to male is 3.907 billion. Life expectancy at birth, 75 years in 2019. This is at the global level, but as you come down or as you narrow your analysis into different regions such as Southeast Asia or the Pacific Island, the number will vary between countries and within countries. How about the mortality rate among females per 1,000 people? It's 118. 482 deaths compared to male with 172. Well, that's higher for male, isn't it? Yeah, but again, as you narrow your analysis into country level or into provincial level, you will see a huge discrepancy in terms of mortality rate. Now, literacy rate. Literacy rate is defined by the percentage of the population of a given age group that can read and write. So age 15 and above, 83% girls, 83% of female globally able to read and write compared to male with 90%. That's a massive discrepancy of 7% gap. In terms of labor force participations, where you have women engaged in different workplace, in different labor, is 38.88% compared to male with more than 70%. So looking at this demographic overview, probably not giving you a clear idea. Still, I'm not sure. I doubted whether I need to focus, my attention to female or women populations. Well, let me give you more information in terms of women's health status. In terms of women's death, whether they are pregnant women or whether they live without any children, 810 deaths, according to the UN agencies, among women die each day. This is not a small number. This is a big number. And even as you narrow your analysis to different regions, the number started to increase, unfortunately. Now, when it comes to female genital mutilations, it is estimated 200 million girls. Hang on, Jericho, what is female genital mutilations? Well, let me give you the definitions. Female genital mutilation compromises all procedures that involve altering or injuring your female genitalia for non-medical reason. So for non-medical reason, for a belief or for a traditional belief, and is recognized globally as a violation of human rights. Because unfortunately, many women and girls who went through these female genital mutilations, they didn't have the opportunity to provide their consents. Usually at the very early age, after you were born, then your female genitalia is being cut. Again, this is violate the human rights. In terms of violence, as you can see here on the slide, 1 in 3 women globally experience intimate partner violence as well as non-partner sexual violence. And most violence against women is perpetrated by their current or former husband or intimate partners. Now, based on the existing data, it is estimated that more than 640 million women aged 15 and older have been subjected to a wide range of violence, particularly intimate partner violence. And this is equal with 26% of women aged 15 and older. So if there is 100 women right now, 26 of you most likely experience that violence. What else? Mortality, female genital mutilations, and violence. Another thing is non-communicable disease or chronic disease, considered as the leading causes of death and disability among women worldwide. So things like cardiovascular disease, diabetes, cancer, chronic respiratory are becoming the main causes of death throughout the world, including if you're living in countries with poor resources. Okay. Now, let's have a look more closely in terms of the situation in Indonesia. When we talk about maternal deaths, when we talk about maternal health, as you can see from this graph, yes, there's been a declining of maternal death in Indonesia since the 1990s, since the beginning of the Millennium Development Goals. But in order to reach the goals in 2030, the Indonesian still requires faster accelerations in order to reduce its current maternal mortality ratio to meet the 70 deaths per 100,000 live births. And as you compare to Southeast Asia region, our MMR is still higher among our neighbors like Malaysia, like Vietnam, or even the Philippines. So again, we still need to accelerate all the health policy, all health programs in order to prevent unnecessarily maternal deaths. Now to show you greater picture in terms of variations of maternal death. If you are living in Sumatra, if you are living in Java, then it's in a better situations compared to our brother and sisters who are living outside Java and Sumatra. As you can see in eastern part and also in central part of Indonesia, the darker the color of the blue represent more maternal deaths, more pregnant women's death, more women's death after delivery, or even just general women's death. This is just to show you we still have inequalities in terms of saving mothers at birth. Now, I've taken this one back from the 2012 data by the World Bank as they categorize the causes of death among women. At the global level, as you can see on your left side, non-communicable disease has the largest proportion causes of death. As we break down into different regions, for example, Southeast, that's where Indonesia is situated at the moment. As you can see there, quite different with the global picture. With the global picture, it's more like, you know, high proportions of non-communicable disease. It still remained the same for Southeast Asia. As you can see, 75% refer to maternal deaths because of non-communicable disease. And we still have huge burden of infectious disease, including neglected tropical disease, with small proportion of injuries. And again, injuries is also another areas of concern that I'm hoping many of you listening to these presentations, you probably want to focus your research, understanding injuries among women, injuries among pregnant women, and injuries among women during their childbirth. Now, if we break down more specifically on what type of causes of death, as you can see, cardiovascular, again, going back to the Southeast Asia region, cardiovascular, almost half of the proportions actually influence maternal death. How about the other? We have respiratory diseases with the green color. We also have a small proportion of diabetes mellitus, some of the neurological conditions. Okay, now, I don't know how many of you are aware about this classical theories of women's triple roles. So back in 1993, Moser and colleague suggested what they call a Moser framework or gender analysis framework, trying to categorize women, trying to understand women experience with their multiple roles and burden. So they come up with 3 different categories. And let me explain to you one by one. So let's start with reproductive work. So as a woman, as a young girls or adolescent girls, later on you are expected to have either a burden, either as a role, as part of reproductive work. What do you mean by reproductive work? As a woman, you are expected to have kids, to have child or children, 1 or 2 or more, and you do need to do household duties, you know, washing, clothes, dishes, and everything, what we call as domestic tasks. And this is traditionally few women with their reproductive work. Now, reproduction of labor is part of the reproductive work. It extends further. It includes the care, socializations, maintenance of individuals throughout their lives, and to ensure the continuations of society to the next generations, as suggested by At Home et al. In 1977. What are you trying to say, Jericho, here? What I'm trying to say here, if you are a woman, if you are a young girl, grow up in a strong patriarchal systems where male dominated every decisions, almost 100%. Unfortunately, you are expected to sustain other family members to ensure that they are healthy, to ensure that they improve their health status. How about you? That's the concern with these triple roles or this particular burden. I put there, women first to get up, last to go to sleep. Now, I noticed there's also men here in this Zoom meeting in this important conference. I'm not blaming you guys, but this is kind of a, awareness. You need to have that awareness that women, regardless their socioeconomic condition, regardless their cultural and religious background, they're the first to get up. Unfortunately, they're the last to go to sleep. And in many societies, including in small pockets area in Indonesia, I noticed that pregnancy is just women's business. It's not ours. Well, I totally disagree with that one. Pregnancy is everyone's business. It's not just women's business. It's because healthy mothers will have healthy children. And if you have healthy children, you have healthy young
Ini Pak
generation.
Sendasri ini kasih orang kecil. Masih pagi.
Could I ask Anissa to unmute your audio?
Halo nih Pak Sendasri.
Thank you so much. So pregnancy is everyone's business. Whether you are as a husband, as a mother, mother-in-law, whether you are as a community leader, whether you are as a religious leader, if you have pregnant women in your community, you do need to care for them. Reproductive work, unfortunately, considered not a real work. Women very rarely rest except at night when they have finished all domestic tasks. This implies women work longer hours than men, and the classical issues, unpaid work, is more often found among women than men itself. Now, the next burden or the next role is productive work, which means women with more workload than men. So initially, I explained to you reproductive work associated with having kids, childbearing, and then do domestic tasks. With productive work is work done by both women and men for payment in cash or kind, which means as a woman, you are being asked to involve to bring income into your families, whether you are as a farmer, whether you work as a fishery, whether you work in the offices, whether you work as a government, whether you will work as an entrepreneur, selling vegetables or eggs in the market, but you still have roles to give more income to the family. Unfortunately, women always with less acknowledgement and value in a strong patriarchal system for many developing countries, not just for Indonesia, but as well as strongly documented in Asia and Africa countries. Productive roles constitute activities aimed at producing consumable or marketable goods and services. And in practice, they will include like farming, petty trade, and all forms of income generating activities. Yet, women still have more workload. Women have longer hours than men in many developing countries. Now, for developed countries, are we seeing the same trend? No. In Australia, even in Brisbane, I still have a number of friends as a man who are not working. So their wife work, but they're not working. So there's been a change of paradigm. I'm also aware in Indonesia, you've noticed this trend where women work and the men stay at home. So we'll see some of this kind of trade-off and negotiation in terms of changing the roles of women in the coming years. And the last burden or roles is community managing and community politics. Yep, you're listening it right. Politics. Women at the community level, as an extension of reproductive role, they also have a pivotal role to ensure the provision and maintenance of scarce resources, things like water, healthcare, education. And it's considered as a voluntary unpaid work and undertake in free time. Unfortunately, there's no free time for women, and I give my empathy to you, to all women here joining this conference. The community politics roles. How about women representations? Starting at your family, starting at your community, do you have enough voice? Do you have enough power or autonomy to exercise your own voice in fulfilling your own health needs and well-being? So that's why I put here, how about women's position in the community? They are unable to make their own decision, even just to see the midwife, even to deliver at the health facility, whether at Puskesmas, at Pustu, they're still having difficulty and not involved in the decision making. So we do need to reflect on this one, because as we move into the pandemic situations, let me explain about the delays model. Many of you probably heard this one from your lecturer as you learn about kesehatan ibu dan anak, 3 delays models. The first delay, as mentioned here, it's more about seeking care, the delay in seeking care or in making decisions. And key factors such as low socioeconomic status of family or women, the women's status in your community, whether they are treated as a first citizen or a second-class citizens. If you delay in making decisions, it is more likely that you will delay in terms of reaching the health facility, especially if you are living in rural or remote settings. I remember a long time ago, this has happened, I believe 20 years ago, when the first time I traveled to Nias Island. We conducted a study trying to understand children under 5 mortality there. I remember I flew with a small plane. It's only 5 of us in the planes, a very small plane, which many of you will probably don't have that experience. But because of the distance, you can imagine if you are living in rural areas, if you're living in remote islands, how will you reach in timely manner in order to receive the care? So once you have delay in making decision, delay in reaching the health facility, then you will experience delay in receiving the care. And which I'm going to explain later on, what will be the factors. Now, you do need to understand that when it comes to delay, it is not necessarily that you need to experience the first delay and then you will continue the second delay or the third delay. It doesn't work that way. It can be sequential, but it can be also random. So perhaps as a woman, you don't have issues in making your decision making. Your husband support you. Your community support your decision to deliver your baby at the Puskesmas or in the hospital. But if you are living in remote island, then you're having difficulty to reach the health facility. Do you have enough funding to support the transportations? And as you come to Puskesmas, as you arrive in the hospital, how about the health staff availability? How about their competence? How about the referral process? And how about the medicine availability? So the first delay, second delay, and the third delay. But in recent years, scholars understanding women's health issues, they suggested, I think we need to focus on the fourth delay. And the fourth delay is about the community engagement. How well do we recognize the power negotiations of the existing social structure and interactions, not just for maternal health, but also for women, understanding their triple burdens. Remember, you have the reproductive roles, you have the productive, and you have the community and community politics. And empirical studies have shown the variations of delays, as I explained earlier. Now, many of you, if you study public health or maternity or nursing students, you'll be familiar with this maternity care or referral systems. Usually you start with your local midwife or bidan desa if you're living in desa, if you're living in villages. Then the report will then be transferred or distributed to higher level, in this case, puskesmas. And if necessary, you need to be referred to the hospitals. So the point is, it's a long journey, even for pregnant women, to go through this process. So the obvious question right now, do we think pregnant woman's business? I totally disagree. Pregnancy is everyone's business. Now, just trying to finish my presentations in several slides. First, delay. So what is the problem then, Jericho? Or call me Bang J. Studies in Indonesia have shown that the evidence more antenatal care visit by providing women. So when you provide women with more power to make their decisions, you will notice positive outcomes coming from their pregnancy, coming from their childbirth process. Males typically are the breadwinners and hold power in decision making, which also include decision making whether you want to deliver at home or at the health facility. The study in Indonesia also suggests that many women, particularly in rural areas, having lack of knowledge in terms of danger signs of pregnancy, illness, including childhood danger illness. And mainly this is because of the misinformation, because of information that they heavily rely from their mother-in-law or mothers or their relatives. So that's the first delay. The second delay will be too far reaching the closest health facility. This is actually taken from one of studies in Eastern Nusa Tenggara or Nusa Tenggara Timur province. So I don't have time to show the video, but this picture is trying to illustrate to you, as the ambulance arrive, they will move pregnant women and into the boat here. As you can see, there's a boat there. And then from here, they will travel behind this mountain. It looks really close, isn't it? When we see the pictures, not. It took them 4 hours to meet just to reach the closest health. And that's not even hospital. That's only puskesmas. So again, as a woman, you have physical and economic issues. And mainly because of that delay in decision making. So the follow-up questions: how to deal with pregnancy with low resources? Perhaps we need telemedicine. Perhaps we need to give or place more midwife or nurses. How about movement from the community? Should we invest more effort in closing the distance gap for accessing health facility in a timely manner? The third delay, the concern in Indonesia as well as in many developing countries, health staff availability. You are a future public health workers. You will be the future leaders. You need to make sure you don't hold off any medical actions if you are being part of that medical actions. I waited too long in the hospitals. I waited too long in this hospital. And this is taken from my PhD study back in NTT province. As a woman, as a young girl, as an adolescent girl, are you aware about your reproductive health rights? Are you aware about your maternity care rights? And how about the distribution of health staff? If many of you willing to work in villages, if many of you willing to work in rural areas, then more likely will be in the better situation.
Oh, Kak Wi, bentar, konfirmasi dulu ya. Kak Wi lagi keluar sana. Ya.
Can I ask again, once again, for all participants to mute your audio? Thank you. For delay, share leadership, which means leadership can be used as a primary enabling factors. Okay. So I've done talking about the gender analysis framework, and then I explained to you the delays. So what will be the connections? what will be in reality? What happened to many women during the COVID-19 pandemic situation?
Kak Wiwi, Mon.
Well, let me tell you,
Ternyata 100 kode
the
kan, Mon.
disruptions to healthcare and education services for women and adolescents have worsened. So the situation back before COVID is already worse. How about during COVID? Much worse situation for many women and girls, including children. As you can see there, many women experience anxiety, high stress levels, and depressions, including frustrations. Women in low and middle income countries with weak health systems experience additional burden given the uncertainty regarding disease susceptibility, vertical transmission to unborn or newborn baby, and management during the pandemic situation for infected pregnant women. Do we aware about the recommended protocols if we have infected pregnant women with COVID-19? What will be the next process? And during the COVID-19 pandemic situations, increasing unintended pregnancies. Unintended pregnancy is a pregnancy that is either unwanted. So as a woman, you don't want to have kid during the pandemic, but then you still have children. You still have a baby during the pandemic. This is what we call unintended pregnancy. As you can see there, in the first year of pandemic, this is just estimations, which I believe probably more than 1.4 million unintended. My kind of predictions is around 2 to 3 million additional unintended pregnancies occurred during the pandemic situations. And during the pandemic situations, there is also a report of shortage of contraceptions. A study was conducted by the University of Melbourne. They're trying to investigate the impact of a lockdown in Australia. So this is more on the Australian context, but more likely will be the same in the context of Indonesia and other low and middle income countries, where what they found, actually, most participants aged 18 to 24 indicated they were trying to avoid pregnancy. So they're trying to avoid pregnancy. And the oral contraceptive pill was the most common single method used. However, nearly 20% reported they were not using contraceptions. So you can imagine if you are a woman being forced sexually, this is unintended pregnancies. And also, we're still dealing with mixed messages on COVID-19 vaccine. If a pregnant woman got a vaccine, you probably hear this one or read from the news, then your baby will be defect, your baby will have autism. Again, those things are nonsense. There's no scientific evidence so far. At least that's what I'm concerned of. Because Australia already started the vaccine program for the pregnant woman, and there's no report or whatsoever about any concern of this hoax informations. And a recent analysis by the Guttmacher Institute estimated the potential effect of the pandemic, 10% decline of sexual and reproductive health services. So there's been a 10% decline, which means because of the disruption, because of the PPKM different level, because of the lockdown, because of the social restrictions, as a woman, you are having difficulties just to improve your health and well-being. Even further, the UNFPA highlighted 3 key things to know during the pandemic. Access to contraceptive is difficult. Interruptions in family planning, which mean you already have 2 kids, but now you are pregnant, can have a long-term adverse effects. And the right to plan family planning should not be compromised. Now, this is just to show you globally, only 41 million, 1.5% men provide unpaid care. How about women? 606 million of women with unpaid care. So you can see 41 million for men, unpaid care for their time with children. For women, 606 million, 20.17% women globally unpaid during this COVID-19 pandemic. And you can see further information about the disruptions of family planning, malnutrition, antenatal care. You cannot just go to your puskesmas. You don't have your posyandu. I know in some part of Indonesia, you deliver your posyandu using a phone call or WhatsApp group, but you do need to have face-to-face. And in order to have that face-to-face, we do need to have a mitigation strategies to ensure low transmissions during this pandemic situations. Further informations about the percentage of countries reporting the communicable disease services. So this is about disruptions because of the pandemic situation in order to access because of the infectious disease, things like dengue, TB, HIV/AIDS, as you can see here, seasonal malaria outbreak for non-COVID, ARV treatment for HIV/AIDS, people living, prevention services. So they all decline, which again, it could affect women's health and well-being. Even further, 243 million women and girls experience sexual and physical violence. And this is before the pandemic. So what happened after the pandemic? It's double, it's triple, it's intensifying. And this is just to show you, in France, for example, report of domestic violence have increased 30%. Even in the Singapore helplines, where you call your helplines, registered increased calls of 30% or 33%. The same pattern in Australia. After the pandemic hit Australia, increased proportion of people calling the helpline because of the mental health issues and also the issues of domestic violence, because many husbands lost their job because of the restrictions and the lockdown situation. So how about Indonesia? During COVID-19 pandemic in Indonesia, I just want to highlight two different case studies. One conducted by a friend of mine that I know, Badia, from the Faculty of Economics in Universitas of Indonesia. So she and her team studied about the unpaid work. As you can see, this is in Indonesia, where you can access the poor women is the most suffered group of populations during this pandemic. Unpaid work with reproductive and community burden, particularly with women with low. Poor women are more likely to have higher risk than men when taking public transport, because usually men will take control the motorcycle or the vehicle. The other case study in Tambak Lorok, Semarang, is saying about a small Indonesian fishing village in central Java, where access to water and hygiene is difficult, and open defecation is quite common. So they have bigger problem, not just the pandemic. They have problem with the road, with the flooding, because it's a fishery. It's a fishery village. They rely on the fishery activities. So with pandemic, things is much worse. So when we think about the pandemic, we're not just thinking about the health issue. We do need to acknowledge the social implication. We do need to acknowledge about other relevant issue as well. And again, with the case in Tambak Lorong Semarang, potentially put more extra burden for women to access water, to secure access to water, to clean the home, and to reminding everyone about the good hygiene. So what can we do? It looks like, Jericho, you're being pessimistic. No, I'm not being pessimistic. We can do better. So what can we do? With triple burden of women's roles during this pandemic. Point number one, women should not be left behind in the pandemic response actions. When you develop your pandemic response actions at the university level, at the community level, RT, RW, kecamatan, kelurahan, at whatever the government level, please put priority, please include women, because when you include women, it will include a package of their children as well and their families. So in developing mitigation strategies, you do need to consider women as well. How to cater their needs and their potentials. Opportunity. With this pandemic situations, I witness more opportunity for women. Are we allowing women to contribute in decision making. Because at the end of the day, if you want to compare women's in terms of their resilience with their economic status, I'm a strong believer that women is stronger in terms of their economic situations, whether you are in a poor situations or a moderate socioeconomic, they know better how to handle that one. So you give more space to them. Mitigations. With the mitigation strategies, are we minimizing risk for women and individuals so that they actually secure feeling safe? Essential health services need to continue to support women's and girls' needs. Yes, following the protocols, the health protocols, wearing face masks, social distancing, all those things are important. Even if you already get the vaccine, I already got my fully vaccine a few months ago. Still, when it comes to going to marketplace where difficult to maintain the distance, I wear my mask and always washing hands. And the last one, network with community structure, work with your religious leaders, understand their perspective. Do they really understand women's triple burden, women's triple roles? And I'm not trying to pointing finger saying like, okay, we blame all the mistakes to the community. No, I witnessed myself. We have a very supportive community and religious leaders. The point, what I'm trying to say here is, again, this is women. This is women. This is who you are, women. You are privileged. You have a potentials to influence the health of these nations, in particular, Indonesia. And now I'm gonna read this one in Bahasa. The quotes from Professor Mahmud Fathala. Perempuan dan anak-anak gadis atau anak-anak perempuan itu meninggal bukan karena sesuatu yang tidak kita bisa cegah, bukan karena sesuatu yang bisa kita tangani, tetapi banyak sekali perempuan dan anak-anak meninggal karena kita sebagai komunitas belum membuat suatu keputusan bahwa nyawa perempuan dan anak-anak are worth saving. Women and girls are not dying of disease we can't treat. They are dying because societies have yet to make the decision that their life are worth saving. No one should left behind. This is just the references if you want to read more. And this is my contact details, the email, the Twitter, and the webpage. Thank you, everyone.
Well, thank you so much, Mr. Jericho Pardosi. So, ladies and gentlemen, now we are in questions and answer sessions. So, Mr. Jericho, there was so much enthusiasm from the participant that there were more than 3 questions for you in chat, but ladies and gentlemen, I'm very grateful and very appreciative for all participants who wanna ask questions to our second speaker, but we will choose the one who raised the hand first because we have a limited time. So I have noticed that the first questioner is Sister Dina Anggreni. So please, Sister Dina Anggreni, time is yours. Please give your questions.
All right, thank you. Am I honorable? All right, I guess I am honorable. So, good morning, sir. I guess it's still morning there and here, so we will always have a morning spirit. Well, I am Dina Anggreni from UIN with Public Health as my majority, and I am in the third semester with FKM 10 as my class. It is well known that our citizen believes tradition more than equality. Equality for them is what they are believing. And honestly, I was surprised that you bring this topic because I thought that in this pandemic, there is no matter are you a man or are you a woman. It's because the majority of caregiver at home, at our environment and in our communities are mostly women. So I'm wondering is it possible that women are more likely get lost or get disadvantaged in this pandemic and how it goes? And also, this is a personal question. Are you a feminist supporter? Thank you. That's all.
Thank you so much, Dina. And hopefully you enjoy your journey as a public health student. I used to be in your shoes because I did my bachelor. Even before that one, I did my diploma 3, and then I continue with the bachelor. Now I'm going to answer you with your second questions because your second question is much more interesting. Am I a strong supporter of feminists? No, I'm sitting on a fence. I'm sitting on a fence, not trying to make sure myself safe. No, I have one wife. One is enough. I have 2 kids, and I guess this is more kind of personal experience. In Brisbane, Australia, we don't have the privilege that you have in Indonesia. You have pembantu, you can help you everything. No, here, as a husband, I need to do almost everything, including washing dishes, clothes, ironing. You just mentioned that one. So I'm not a strong believer of feminists. In a way, I just want to acknowledge the important roles of women throughout histories. If you go back to histories, because there's a famous quote saying, "Never forget histories." In the histories of revolutions, in the histories of struggles of Indonesia, we do have women heroes, isn't it? Which, well, unfortunately, they don't, accept, or they don't accept. I need to repeat that. They don't receive enough acknowledgement. Okay, that's the second question. The first one, why women is so fragile? Again, it's coming back to the perspective that back in the old days, women perceived as a weak kind of human being compared to a male. Traditionally, male is well known, you can lift heavy weight, but right now, look what happened. Many women now becoming weightlifter. They can lift even heavier than your own weight. I knew a friend of mine here in Sydney. She's a woman, she's a mother. She could lift 200 kilograms of squat with barbells. Can you imagine that one? 200 kilograms. I can assure you, many of men here listening to this presentation, you cannot lift 200 kilograms of squat. So the point I'm trying to say here, it's going back again to the political will, to the social structural kind of recognitions of women's important roles. As I mentioned earlier, they have 3 different roles: reproductive, productive, and community politics. How about women representation in our DPR or MPR? It's increasing, but we need more, because by having more, at least we have more women's voices. Hopefully that answers your questions, Dina.
All right, thank you, sir, for your explanation. I'm really grateful.
Good luck for your study.
Okay, thank you very much, Mr. Churiko Paradosi, for the answer, and thank you very much for Sister Dina Anggreni for the question. And then we will next to the second questioner. So I will let I will let Mr. Egi Dewanata Putra to ask. So please, Mr. Egi Dewanata Putra.
Okay, thank you to Honorable MC for the occasion that you give to me. Okay, good morning, Mr. Padosi. First of all, my name is Segonata Putra. I'm a public health student from Islamic State University of North Sumatra. I just want to ask you one simple question, Mister. In the earlier presentation, you said one of global challenge for women is women don't receive needed healthcare service, right? So my question is, what is the factor that make women do not receive the needed healthcare service, Mister? I think that's my question. Thank you.
Thank you, Eggy. Thank you for your questions. And again, hopefully you enjoy your learning public health, because public health, I would say this one, if you still doubt public health, why am I doing public health? Public health save million, doctors save individuals. I'm gonna say it again, public health save millions of people, doctor only save individuals. Sorry for any doctors here. Again, why women experience, difficulty in accessing healthcare services? It comes back again to the expectations. Do you allow women to take part in decision making? In my PhD studies in Ende district, this is a small town in NTT province, I found out that many women, especially in eastern part of Indonesia, and I can speak on their behalf, they're having difficulty to access the healthcare services because they have multiple roles. They have to help the husbands with their farming and fishery activities. They have to do the household chores, the domestic tasks. So there's so many responsibility and roles. And their position in the society is being considered as a second-class citizens. Unfortunately, that's the reality in many developing countries. So by just understanding women's positions, lack of decision-making, especially if you are coming from a society where you value women unimportantly compared to boys. In Indonesia, we still have that common perspective. It's good to having boys than girls, because having boys, you can help you with your work later on compared to girls. But again, I disagree with those kind of perspectives. And another issue is why women are having difficulties not receiving adequate healthcare, because in terms of accessibility, in terms of their locations, when they wanted to go to puskesmas, is there midwife there? Is there nurses there? Is there any health staff there? Back in, I guess in 2 decades, 2 decades ago, the government in Indonesia, they promote a program called Bidan Desa. So they distribute each village with one bidan. What is the current situations? Not many of them still work in villages. So women's positions, healthcare availability, or the state of healthcare systems, as well as their location as well. So many complex issues, but overall, we can change that one by giving them the autonomy to make their health decision making. Thank you, Eggy.
Yeah, thank you, Mr. Padosi, for the explanation. Success for you, Mr. You again in another occasion.
Okay, thank you very much for Mr. Jericho Parosi and Mr. Regi Dewanata Putra. And next, we will turn to our third questioner. So please, Mrs. Novia Arianti Tanjung.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Thank you for opportunity. Before it, I'm so sorry about if I say the wrong words, because I can speak English fluently, sir. In my question is just wanna ask your opinion about your opinion. Why there are so many cases of women experiencing about mental illness, sir? Thank you.
Thank you, Novi. Thank you for your questions. And it's all process. Before I speak English or I work in Australia, this is not the way I speak English. So don't worry. Work in progress, study in progress. You'll get there. Now, going back to your questions, why women are having more mental health issues? Well, again, let's just go back with that triple roles: reproductive work, productive work, and then community managing and community politics. I've received a lot of report from my colleagues in eastern part of Indonesia. They're working as a bidan, they're working as a petugas puskesmas, they're also public health graduate. They were saying that we also have stress in delivering services during this pandemic situation because people expect high quality of standard. At the same time, we also want to ensure that it is safe to go to the healthcare facilities. How about women itself working outside the health sectors? Well, if you are a poor woman, you will have more poor mental health issues. Imagine if your husband being redundant, laid off from his job because of the restriction, because of the lockdown situations. Who will support? Who will sustain the family needs in terms of the daily food? Who will support that one? And don't forget as well, with the restrictions, you cannot do much. You will stay at home with the same person. There was a saying, I think in Indonesia, 4L, lagi lo lagi. You can imagine that kind of saying like, you don't have jobs, I don't have jobs, what can I do? Especially if you having kids with illness, with serious illness, that put more pressure. And we do need to take care of this mental health issue seriously. And I mentioned this one in another seminar with a different university. I think this message will goes to all my fellow colleagues, all the lecturers. Please also acknowledge the struggles experienced by your students with the distant learning. I'm not sure many of them will have enough quota just to join the Zoom sessions every single day. But I'm sure UIN will support that one. This is just a reminder. Thank you, Novi.
Thank you, sir.
Okay, thank you very much for Mr. Jericho Pardosi and Ms. Novia Arianti Tanjung, because we only have 10 minutes for Mr. Jericho Pardosi session, so I will choose the last questioner for Ms. Melissa Lutvia, so please.
Okay, hello, sir. The first, I want to say thank you to Mr. Jericho Pardosi. The material is very good and very useful for me. The first time, my name is Melissa Lurvia from Public Health UIN. I want to ask, how do you respond to meaning of women's contribution in making decisions and strategy in handling the COVID-19 one in pandemic? Thank you, sir.
I'm sorry, Mr. Jericho. Your microphone is
sorry. Yep. Thank you. Thank you, Melissa, for your question. This is a simple, but it's worth a million questions that many people trying to understand. I guess I'm just being optimistic. The practical way to involve women in terms of pandemic response is to know what are their needs. Talk to them. If you're doing research on women or pregnant women, talk to them, trying to understand their daily experience, trying to understand the struggles that they're going through on a daily basis. That's kind of the opening gate to understand, and before you kind of formulate your pandemic response. For example, during the first wave of pandemic in Indonesia, discussions with many of my doctors, colleagues in different hospitals. Do you have any resources, Jericho, in Australia in terms of health protocol? What sort of health protocols in Australia in terms of allowing women to give birth at the health facility? And at that time, I remember we discussed intensively, and it comes down to rapid need assessment. Have we talked to women? What do they need? Perhaps what they need is not just about attending, but what they need is support in their transport to the health clinic. Perhaps what they need is allowing more kind of, have face masks, It's a simple thing, but I still receive report from my colleagues working in eastern part of Indonesia. They don't have adequate face masks to be used. And this is just a simple things. Another practical way is involve the community leaders, involve the politicians. I don't like politics, Jericho. Well, congratulations. Public health is also about politics. You do need to influence the political kind of domain. I'm not saying like everyone should graduate and becoming DPR, menjadi anggota DPR. No, I'm not saying everyone should be anggota DPR, but some of you, I'm hoping, and I also pray for that one, some of you will be a legislative members. If you are sitting down in legislative members, remember to talk to your communities, talk to your religious leaders. At the end of the day, religious leaders, it's the most influential key stakeholders for sustainable health policy and programs, especially with this pandemic situations. And that's why I break down the acronyms of women. Put women, opportunity for women, mitigation strategies, essential, vaccine coverage, posyandu. You need to deliver that one on regular basis, but with some adjustment. And the last one is network with the your community institutions. Thank you, Mary Lisa.
Okay, thank you, sir, for the answer and your opinion. It's good job.
Well, thank you very much for Mr. Chirico Pardosi and Miss Melissa Lutfia. So, ladies and gentlemen, I'm very sorry for not being able to invite all of you who want to ask because our time is limited. But don't worry, because in the next session we have third speaker, so you can ask to her if you wanna ask. So, Mr. Jericho Pardosi.
Can I say something for moderator? For many of you asked on the chat column, I've already copy and paste, and I'll provide my response in the coming weeks. So I'll definitely respond to every question, and I'll send email to Ibu Fitriani if that's okay. So many of you ask questions, don't worry. I'll answer that one via email, and Ibu Fitriani, if you don't mind, you can distribute my answers later on to your students. Thank you.
Well, thank you very much, Mr. Jericho Pardosi. So it's a good news for us. So if you not yet to ask your question to Mr. Jericho Pardosi, so you can email. So
Moderator, I think you are mute. Your audio is muted. I can't hear any audio.
oh yeah, thank you, Mr. Jericho Pardosi. Okay, so before we close this discussion session, I want to conclude our discussion so we can conclude that women should get more attention during COVID-19 pandemic. So it's not about just physical health, but also mental health, and the public health must take a place for this problem. Okay, Mr. Jericho Pardosi, before we close our discussion session, we will do photo session first. Okay, Mr. Jericho. Okay, for all participants, please open your camera because we will get photo session with Mr. Jericho Pardosi. So please, the committee. Okay, please open your camera. And 1, 2, and 3, smile. Okay. Okay, it's done. Thank you very much, Mr. Jericho Pardosi. We hope we can see you in other occasions.
Thank you, everyone.
Okay, good afternoon, Mr.
Good afternoon. Thanks.
Most welcome.
Hello, good afternoon.
And then about her research is on January 2021 until now, there is a research that entitled Raising Tax and Price on Tobacco Product for Health Promotion and Stunting Alleviation in Indonesia. And then on April 2020 until now, also in action research implementation of early child care and nutrition education as long distance learning module. And then you can see all the research on the screen. There are many research. And then for research publication, you can see there are more than 10 research publications. So the first about long working hours for sleep quality and work-family conflict, determinant factor of fatigue among Indonesian tugboat crew members, Mansur M. Sagi, and the writer is Mansur M. Sagittaria, and etc. So you can see all of her publication on the screen. There are many publications. So hello, Dr. Wange.
Hello, good afternoon.
Yeah, okay. Yeah, thank you. Thank you, Doctor, for joining us. So I think all participants wanna to hear some great information and education for you. So I will let you to deliver your material. So please, Dr. Wange, time is yours.
Yeah, thank you, Madam Moderator. So I will share my own screen. Yeah, so this is correct timing, yeah, because we have almost lunchtime, but I have to deliver the topic on diets, food safety, and food access. So this is the only topic that block you from the lunch. Hopefully, you still have, you still manage to hold your hunger for a little bit and have this small discussion on the pattern of diet, food safety, and food access in Indonesia during the COVID pandemic. So my name is Grace Wange. I came from Simeo Rekfon, or the Pusat Kajian Gizi Regional Universitas Indonesia. That's below is my Twitter account and also the Twitter account of Simeo Rekfon. So the work that I'm going to present is actually part of my students' work. So they are, we have the applied knowledge module every year in FKUI. And for the last 2 years, because we cannot conduct a field study, we changed this field study into a survey, online-based survey. So these two, the work that I'm going to present is the result from two online surveys that we conducted in early 2020 at the beginning of the pandemic, and last May when we still in the pandemic, but we're not yet reaching the second peak, yeah. But hopefully this the result can give you an idea on how the dietary habit of Indonesians and also their knowledge of food safety and also how is their food access during the period of the pandemic in 2020 until 2021. So just a background about my organization. So what is Simeo Rekfon? So Simeo is actually a Southeast Asian Minister of Education organization. We are a regional intergovernmental organization who were established in 1965. Yeah, so almost the same age as ASEAN. So, but it's a separate entity from the ASEAN. And we are actually under the Ministry of Education in Indonesia. So we work not really on health, but we work in the cooperation of education, science, and culture. And my center is focusing on, of course, education science in food and nutrition. And in Universitas Indonesia, we were known as the Pusat Kajian Gizi Regional. Yeah, so actually in Southeast Asia, there are 26 centers and every center has a different focus. So as a background, because I was told to share something about how is the community nutrition situation in Indonesia during the pandemic. So this is the background that make us conduct these two separate survey. Basically, we are aware that the COVID-19 as a pandemic will give a lot of impact on food system. Yeah. So a lot of things can affect the food supply because of the pandemic. The first is availability, of course, because of less activities, because of the restriction between areas. We will see maybe a shortage of staples during the pandemics. Yeah, especially the fruit and vegetable shortage. Because if you know, fruit and vegetables, we cannot really keep them for long. And we really need a fresh stock every time. And with the pandemic, with the restriction between area, this will cause a problem on the fruit and vegetable stock. And of course, we will expect that because of the pandemic, because of the restriction and the number of high infection, for example, we will expect the risk of inflation on the food prices. Again, especially for fruits and vegetables, because they were such, we cannot really maintain the fruits vegetable for a long time, and their price could be fluctuative also. And also mostly because of the restriction, we will see that maybe the accessibility of people to the healthy food will be reduced, yeah, because people cannot go anywhere. You cannot really go to a place where you can access fresh produce, yeah, during the pandemic, because you have to stay at home, and you really rely on the food vendor near your house. So we will expect that during the pandemic, people will probably eat less healthy food compared to the situation before the pandemic, when we don't have the restriction. And because of the loss of job, yeah, during the pandemic, of course, a lot of people will lose their job, lose their income, and they probably cannot afford to buy food anymore. Yeah, not just food, but especially probably healthy food, because in some country, especially also in our country, sometimes the price of healthy food, especially fruit and vegetables, they're quite could be quite expensive. So we will expect that people probably become less healthy, although they do have to be more healthy actually, to eat more healthy food during the pandemic. But maybe their access to healthy food is getting less and less because of the restriction of movement. Yeah, and also convenience, because I think in the previous presentation by Dr. Pardosi, you talked a bit about mental health. When you stay at home, you prefer to have a more convenience food. Yeah, you stay at home, you work from home, learning from home. You tend to have more snacks. Yeah, so you will prefer probably more convenience food rather than probably healthy food. So that will also affect your diet. Yeah. And of course, because you're staying at home and you have to save food, yeah, you cannot you maybe because of the large restriction, you cannot go out every day to buy food that's on the market. So you have to probably go just for a week, or once a week, for example. So you tend to buy food that you can keep longer, and that will also affect your diet pattern. Yeah, you probably tend to buy more ultra processed food, because they will stay longer. uh, they're not easily rotten compared to the fresh food. So with all this condition during the pandemic, because of the restriction, because people cannot go out and do a food shopping daily or more often, we expect that the food habit, and also the food safety and food access of Indonesian, because of the large recession, will be changes, yeah, because of the pandemic. And that will also in the end threat, because it will increase and the level of malnutrition, because you don't really have access and eat healthy food. The people who are already malnourished, maybe they become more malnourished. The people who are obese become more obese, yeah, because they probably just eat they eat more ultra processed food, convenience food. Yeah, so it's really probably it's hard to reach healthy diets during the pandemic, also for Indonesian. But that's what we want to see in this research. Is it true that for Indonesians, this changing of food habit, dietary habit, is also happening, yeah, during the pandemic in 2020 and 2021. So we conducted two surveys, yeah, two online surveys, with the objective to assess awareness, knowledge, and behavior toward healthy food, food safety, and food access during the COVID-19 pandemic in Indonesia. So the survey in 2020 is actually the beginning of the pandemic. Yeah, we collect the data in May 2020, and we compare the situation in May and before the pandemic, which is we asked the respondents to recall their habit during December and January to December 2019 and January 2020, right? And then a year after that, in 2021, in last April and May, we conduct another survey, but we ask different people. Yeah, so it's not the same subjects. And we compare the answer, the situation in the 2021, and we ask the respondent to recall their memory during their habits, yeah, during mid 2020. Yeah, so as you can see here, this is two different surveys with different respondents. But the number of this subject is quite large, and we hope it will also give a description on the situation of the Indonesian population in terms of their diets. Yeah. Okay. So this is just a specific objective. So basically, we want to see the how is the food access, yeah, of the Indonesian during the pandemic. How's their food safety practice? Yeah. We were wondering whether because of the pandemic they will because of the all the information that you need to wash your hands before doing a lot of any other activities, you probably have a better food safety practice, because the one of the point of doing a food safety is how you're going to wash your hands before before cooking and also eating. And also, we want to find out what are the related factors that affecting the access, the food safety practice, and also the food access of Indonesian during 2020 and early 2021. So this is the method. So again, to survey, we are using Lime survey platform. And we actually calculate the sample size for 2020. We actually require about 346 respondents with the minimal, we add 10% of it, and we reach the minimum sample size of 381. And in 2021, based on the data from 2020, we recalculate the sample size, and we actually only meet 138 respondents. But because we're thinking about low response rate this time for this survey, because during that time, a lot of survey had been conducted. So we're thinking maybe they don't really respond to our invitation for survey. And we calculate that with the respondents of 30%, we will need about 500 response. Yeah. And we use a convenient samplings for the survey. We're using snowballing. Yeah. So we post the link of the survey and distribute it through social media, Instagram, Twitter, Facebook, and also using WhatsApp. And also we write invitations, and we kind of encourage the respondents who already respond to our invitation to invite their friends, yeah, to also answer this survey. Yeah. And this is our inclusion and exclusion criteria. So we basically include adult. In 2020, we limit the adult for 20 years and above. But in 2021, we reduce the age limitation to 18 years old. And the respondent has to be living in Indonesia for the last 6 months. Yeah, and they are Indonesian citizens. And we exclude the respondent who actually did not complete the survey, the whole survey, yeah, because the survey is there's a lot of forms. It took about 30 minutes to complete. So the one who answered less than 30% of the total question, we exclude them. And we also in 2021 exclude respondent who said that they're following a special kind of diet. For example, they are vegetarians, or they have this, a special carbo diets. We exclude them because we think they will have a different pattern, different answer to our questions. Okay, and this is the results. So in 2020, we have in total for about 460 responses eligible for analysis. In 2021, we have slightly more, about 551 eligible answer for analysis. Majority of our respondents are female. Yeah, so both in 2020 and 2021, we get more than 75% female answering our surveys. The majority of the age group are youngs. They are the generation, maybe some of you is also one of our respondents. So about 20 to 29 years old, so below 30 are our respondents. Mostly, almost in 2020, almost 90% is actually having a university degree, so high educated. And in 2021, the number is slightly reduced, so more we have more variation in terms of educations. But and also unfortunately, the survey was answered by more than 70% of people who answer our surveys, both in 2020 and 2021, actually live in Java, which is actually would be our limitation, the limitation of the survey. Only about 10% and in 18% in 2021 is actually living in Sumatera. Yeah, so this could be a disadvantages for the survey. And if you see the socio-economic, they also come from middle to high socio-economic status actually. Although they said that their monthly income usually less than 1.8 million rupiah, but most of them is actually not, but about 20% is actually in they have the UMR, yeah. And if you see the income changes before and after pandemic, about half of them did not have a change in the income. And when we asked in 2021, our 2021 respondents, also more than a half, did not feel that they have a change in income in 2021 compared in 2020. So this is more like our respondents more likely a stable, yes, a stable respondents in terms of economic income, yeah. And about only a small percentage actually live by themselves, yeah, less than 15 or less than 16%. So majority is actually live with their family or supporting their family, meaning they live with their partners, their children, or their parents, yeah. In 2020, because not when we conduct the survey, not all the region in Indonesia have large-scale social restrictions. So only about 70% of our respondents actually living in the area where they have large social restriction. But we did not ask about this question anymore in 2021, yeah, because it's not really clear anymore in 2021 during that time about the regulation about large-scale social restriction. So actually the people in 2020, they experience more large restriction in terms of mobility compared to the one in 2021. Because in 2021, because this is the survey, we cannot really see the restriction actually. So most of our respondents actually receive, not many is actually receive social support, yeah. So you know the government provide the people of Indonesia some social support like BLT, like Kartu Prakerja. So only about small percentage of our respondents receive that support from the government. But interestingly enough, about 13% is actually said that they receive support not from the government but from their family. So this is typical Indonesia, yeah. So in terms of social support, we rely first with our family compared to from the government, yeah. Even in the pandemic, our social support, our social network in terms of family is still able to support us if we have difficulty in accessing food or something related to health, yeah. So still first we go to family and government second, yeah. So if you see their food expenditure in 2020, and this is the early pandemic, we see that most of them is actually when this food expenditure is how much you spend for food, yeah. So only about 40% said that they have increased food expenditure. Okay, about 45%, almost 50% said there is no change. Yeah, in 2021, the number is changing. About 50%, half say that they changed their food expenditure, and about only 30% said they have no changing in food expenditure, and about 19% is actually reduce their food shopping. Yeah? So if you can see here, actually, majority of respondents at this survey, both in the early pandemic or in the later stage of the pandemic, they don't really have change in terms of the money that they spend to buy food is not really changing. Although later in the pandemic, maybe because they already adjust to the condition, the food expenditure is slightly increased. Yeah. Although we can still see some of them is actually decreasing their food expenditure. And in terms of physical access, whether they have access going to the market, in 2020, about almost 90% said they don't have those difficulty. Yeah, they can easily access food vendors near their house. And the same thing also happened actually in 2021. People doesn't really complain that they cannot access food vendors. So warung or small stores is very available in their area, and they can still have access it. And interestingly enough, both in 2020 and 2021, the more people is actually prefer offline purchase for food, yeah, compared to online. So we're thinking about because of the pandemic, people will buy more food online, but apparently it's not the case, yeah. Both in early pandemic or later pandemic, people are still prefer for food, especially fresh product. They prefer to buy it offline, yeah, not online. Okay. Yeah. So this is also the in the early pandemic. You can see here actually people are buying food in more during the pandemic. More people actually buying food from traditional market. Yeah, but there's a lot of increase in people who actually buying food from the supermarket. Yeah. And we don't really see a difference in terms of online. Yeah. So still, even during the pandemic, people said maybe it's easier to buy food via online. We don't really see that in our respondents, even during 2020 or even in 2021. So seems that maybe people are buying online for other things, yeah, not really food fresh product. Okay. Yeah, this is the same as you can see here for raw food. People who change from offline to online, the purple bar is very low. Yeah, even for ready to eat food. Yeah, so and people who keep buying offline the number is still stable. Yeah. So this is seems like the preference of food shopping, yeah, both in 2020 and 2021. That's food shopping. And how about their coping strategy? So coping strategy is your strategy. So if you have less money, what should I buy for? What should I eat? Yeah. So in 2020, in the early pandemic, you see more variation in the coping strategies. Yeah. So because maybe it's still early pandemic, people doesn't really know what will happen in the next 2 years. People still trying different strategies of how they can manage their money to be able to save and buy food. So here there are more strategies, including growing your own food. It was very trendy, right, in 2020. But we don't really see that strategy anymore in 2021. Yeah. So what happened in 2021? We see less strategy. People are trying to survive by make this portion smaller, yeah, or by prefer or less expensive food. Yeah. If you see in 2020, more people actually have the strategy of growing their own food, their own food plants, yeah, or even like purchase food on credit. But that's not really shown anymore in 2021. Yeah, so maybe people already adjust to the pandemic, and they already know what to do with their savings in terms of food. Yeah, so either I eat less food or smaller portion, or I just buy a less expensive food. But it's also probably because the less expensive food is already there. Yeah. And for the food score, yeah, food efficiency score, we see that actually both in 2020 and 2021, we do not see really a lot of people say that they have difficulty of accessing food. Yeah, so food is not really an issue, yeah, for our respondents in terms of buying and having it. Yeah. But we see an increase of a number of people who said that they were less able to access food in 2021. So although it's not really large, the gap, but more people actually in 2021 say they were less able to access food, yeah, to buy food, healthy food anymore in 2021 compared to the early pandemic. And yeah, and you see here, this is the multivariate table. And some factors actually influencing how you're going to become able to access food. Yeah, one of them is education. So people with higher education said it's easier for them they know where to get their food. Yeah, they know where they can get access to healthier food. So, and this is something that is shown in 2020 and 2021. People with higher education, they are smarter. They know where to get their healthier food better than people who were less educated. Yeah, and yeah, and you can see here that people with more coping strategies actually struggle more in accessing food. Yeah, so the higher the number of adapted their coping strategy, the higher chance they become less able to get food. Yeah, so that's why people have a lot of adapting strategies, because they have a lot of challenge, they have difficulties of accessing food. Yeah, so people with only one adapting strategy, they usually doesn't really accessing food is not really a problem for them. Yeah. Okay. Yeah. And about healthy diet, in our respondents, both in 2020 and 2021, we see that most of them is actually have a good practice, yeah, in healthy diet. So they know what is a healthy diet and they already practice it. But we see during the pandemic in April 2020, the number of people who practice healthy diet is actually increased compared to before the pandemic. Yeah, maybe because of the pandemic, they were more motivated to do a healthy diet practice. Yeah, and we see here, although the number is only slightly increased, only 2% increase. Yeah, and we see even in 2021, more people is actually practicing healthy diet. So this is maybe one of the good thing about pandemic, yeah, because we know that if this is an infection, you have to increase your immunity, you have to practice healthy diet and healthy lifestyle, yeah. So a lot of people have actually increased their practice of healthy diet in 2020 compared to 2021, this is a slightly well, you can say a positive effect of the pandemic. Yeah. And this is just about the information. So where they get the information on which food is healthy or not. And both in 2020 and 2021, our respondents said that majority they get the information from social media. So social media is really influencing, giving them information on what is healthy diet, how to behave during the pandemic. Yeah, maybe also how they can process food better, cook the food better. Both still in 2020 and 2021, social media take a major role, and also they get a lot of information also from interesting enough from still from electronic media, so from television, from radio. They still get this information about how you can practice healthy diet, yeah, and food safety. Okay. Yeah. So what are the determining factor of this healthy diet? So we see in 2020, if you have less availability of healthy food, you have two 2.5 times higher risk to have poor healthy diet. So really your healthy diet is determined by the availability of food around you. Yeah. So if you have less availability of healthy food, you will be 2.5 times prone to get a poor diet. Yeah. And also in early pandemic, we see that if you have less access to food, 2.7, you will have 2.8 times higher risk to have a poor diet. So really someone will practice poor healthy diet is because it's really determined not by their knowledge, yeah, not by the attitude, but by the availability of healthy food around them. That's what we found in early pandemic. In 2021, basically similar situation, we found a similar finding, but interestingly enough, in 2021, we found that one factor that affecting your healthy diet, how you go affect your diet during the mid-pandemic is family support. Yeah. So if your family supporting your diet practice, you will be your chance of practicing healthy diet will be increasing 1.13 times higher compared if you don't receive a family support. So if your family is actually maybe because in 2021 people are living with majority are living with their family, so it's really your family is influencing your healthy diet. Yeah. And again, the second point of the 2021 finding is the healthy diet is negatively associated with a respondent who less able to access food. So again, with this result, we see that a person in Indonesia, when they want to practice healthy diet, is really determined by the availability of healthy food. If they have access to healthy food, they will practice it. It's not like they don't know about what is healthy food or they're against a healthy food. It's more like based on the availability of food around them. And also family support is really important in them when they want to practice a healthy diet. So that's we found that it's a very interesting finding. So we cannot really say that the impact of that result is we cannot really say to people, yeah. Of course, as a public health practitioner, some of you are medical doctors, you will be happy to always give an education to people. You have to eat healthy diet. You have to eat more vegetables. You have to eat more fruits. Yeah, you have to have a balanced diet. But again, if the food is not available, we also see from the survey during the pandemic, they cannot really practice it. Yeah, and also if their family is not supporting them of practicing the good healthy diet, our education will not change the behavior. That's the important point that we draw from that result. This, as you can see here also in my current slide, most of our respondents is actually have a good knowledge, yeah, on what is they categorize as safe food, yeah. Either for home cooking or for eating out. So they have a good knowledge, they have good attitude, but and then some of them say that they also have a good practice in terms of food safety. Food safety meaning that when you know how to prep the food, yeah, according to the food safety principles. So they already actually when the beginning of the pandemic, they already practice it well, yeah. So it's not we don't really see any changes, except that we see that for people who practice food safety during the pandemic, it's actually they already have a good safety practice before the pandemic. So actually, when you already practice good safety habit, food safety habit, yeah. It continued during the pandemic. So it's not because of the pandemic, then you will be more aware and start practicing more, become more food safety aware about the food that you prepare. But it's more because it's already your habit. Yeah, it's already your habit before the pandemic that you always cooking with the food safety principle. So it's not just because of the pandemic you started it. That's what we see in 2020. And 2021, we don't really ask about the same question about food safety, but we ask additional question about eating out, because during that time people are already starting eating out, going out to the restaurant and eating out. And we see that even though when at home they know they have a good practice, yeah, of home cooking, so they know what is food, what categories as safe food, how to cook it, how to eat it. But when they're going out, eating out in the restaurants, the attitude is less compared their attitude during doing a home cooking, yeah. And even for the practice is 50-50. So some people says that it's easier to practice food safety inside the house compared to outside the house when they're eating out. So we're asking them during this period about, because of the pandemic, there's more restriction, and when you're eating out in the restaurant, yeah, you have to stay at the only maximum 20 minutes. You have to keep a safe distance, using your mask, wash your hands, etc. So some about 50-50 is actually not following that that new protocol of eating out during the pandemic. Yeah, so that's what we see in 2021. Yeah, I think this is just a conclusion. So one of the finding is we found that actually your attitude in terms of food safety or your practice during in terms of food safety is not really related because of the pandemic, but more related on your previous habit. Yeah, so if you already have a good habit, you will continue that habit during the pandemic. But still, if you have good knowledge, you have a good attitude, it will also influence your practice of practicing the food safety habit. Yeah. Okay, and we also see that people who obey the protocol of food safety usually are younger, yeah, so 26 to 32 years old, and mostly female. Yeah, so female are more I don't know, aware and more goes with the protocol that was already determined about how you're going to eating out during the pandemic. Okay. So as a conclusion of our study, so we see that during the early pandemic in 2020, yeah, the practice of healthy diet during the phase is really influenced by the availability of healthy food. So if you have access, you can buy healthy food in a good in a considerable price. You will practice the healthy diet. Yeah. And your practice for food safety, how you prepare the food, is really determined by your behavior before the pandemic. So people with already good behavior will also have a good behavior during the pandemic. But you also see that more women actually have a better behavior. But this can also be influenced because majority of our respondents are women. There are increase in awareness of food safety during COVID-19. So people are more aware that if you receive food, with temperature they have to keep the food on, what they have to do with the packaging. Yeah, so especially during the early pandemic when we still have this theory that food can transmit the COVID-19, people are more aware of about the safety of their food. Yeah. But it's actually not influenced by the level of knowledge. Yeah, it's actually more in use by because the awareness of the COVID-19, because they don't want get transmission of the COVID-19 from the food. Yeah, and really education level, your employment status, your access to food, your social support will really affect your food dietary habit. Yeah, and then 1 year after pandemic, we found that again, your knowledge, your attitude, your source of information, and your family and peer support, age and family is influencing your healthy eating behavior. So a lot of things, and these factors actually not different with the situation without the pandemic. Yeah, of course, someone will have a healthy eating behavior, and it will be really determined by their knowledge, their attitude, their source of information, and also their environment, their family and peer support. And then we see that there is a significant relationship between knowledge and food safety towards home cooking. Yeah, so when you prepare the food at home, our respondents are actually more aware of what is the good way of preparing food, what is the safest way to prepare food, but not during eating out. Yeah, eating out is still an issue. And yeah, people access to food in 2021 during the 1 year after pandemic is really educated with their level of education, their working condition, their change in income, and their access to raw food and their coping strategies. So if you can see here from this conclusion, there's not much different between the 2020 and 2021 in terms of dietary habit, food access, and also food safety practice. Yeah. So is actually what we conclude from this two survey is the pandemic probably slightly increase your awareness about how you should have a good food safety behavior, but not really actually changing your dietary habit or your food safety awareness, right? It's really your habit, your is determined by your surrounding, your access to food. If you have access to cheap, healthy food, you will do it, but not because of the pandemic or other causes. Yeah, that's what we conclude so far from this two different surveys. I think that's all. That's my last slide. So maybe if you have something to discuss, I can address your questions. I go quick, so you can have quick lunch. Yeah.
Okay, well, thank you, Dr. Grace Wangi. So, ladies and gentlemen, now are the time for the question and answer sessions. I would like to have 3 questions first from the participant, and I will choose who raise hand first. So please, ladies and gentlemen, if you have a question, please raise your hand. Okay, first I will see who raised hand. So after that, I will see our chat room. Okay, I get it. So please for Mr. Shahril B. Purba, so please give your question to our speaker. Well, hello, Mr. Shahril B. Purba.
Hello.
Hello, Shahril.
Hello, Miss. Good afternoon, Miss Grace. Introduce my name, Syaril Budiman Pasaribu from Winsu. I want to ask Miss, how can we the food that we asked to eat often quality food to eat healthy food?
Sorry, I think your voice is breaking, so maybe the moderator can hear better. Can you maybe speak slowly so we can hear your question better?
Okay, yes.
So you were asking about what food we can eat, something like that, because your voice was breaking.
Good afternoon, Miss. May introduce my name, Syaril Budiman Pasaribu from Winsu. I want to ask Miss, how can we change the food that we use to eat often you healthy food to have healthy food?
Sorry, moderator, can you repeat his question? It's still breaking on my side.
Okay, well, Dr. Grace, so I will repeat it again, maybe like this. Mr. Shahril Budiman asks you, how can we change the food that we used to eat often unhealthy food to eat healthy food?
Okay, thank you for your question, Shahril. That's a good question, actually. So how can we change? First is, of course, we have to of course, our knowledge of what is a healthy food is really important. So if we have enough knowledge of what food is considered healthy, it will be a good start for us to change our habit. But again, eating healthy food is a habit, yeah. It's something that is not be instantly changed. So first, you have to have good knowledge. You have to know what is the food that is considered healthy. What is a healthy food? You have to know that. And to do that is very easy. I mean, like in Indonesia, we have the balanced nutrition guidelines, yeah, panduan gizi seimbang. So we have panduan gizi seimbang, yeah, not 4 sehat 5 sempurna anymore. A lot of people still have a mistaken on that. And you can just follow. And for every time you eat, you have this guideline called piring makanku, yeah, about how the proportion of each type of food every time you eat. So how much vegetable, how much fruit, how much meat, how much carbohydrate you have to eat. Just follow that and try to practice that every day. Remember that every day. If it's very difficult for you to do 3 times a day, maybe at least once a day. And of course, again, it really determines by your access. Yeah, healthy food doesn't have to be expensive, but I understand maybe in your region, in your area, it's not easy to get fruits or vegetables or other healthy type of healthy food. Yeah, because maybe you live so far from the market, or people like, for example, people in the eastern part of Indonesia, it's difficult to get fresh products. Yeah, because of the distance. Just look at local food that you have at your market. Yeah, what kind of food that have this that you can combine. So you have you can follow the guideline of piring makanku, or at least make your food colorful every time you eat. Yeah, that's what the simplest way is. Remember to make your food, the plate that you eat is colorful every time. So not just dominant one color, white, because only you eat only rice. Yeah, rice with noodles. It's not really colorful, right? So just make your food as colorful as possible, but don't put too much chili, yeah. That's also that could be one of the secret that you can start your habit and change your habit. And also eat with your friends who have the same aim, yeah. Eating with friends who also like to eat with healthy food is really important, because you will get motivated by your friends, by your peers. So choose your friends wisely, yeah. Only choose friends who wants to have a habit of healthy diet. That will also help you change your habit. I hope that answered your question, Sadil.
Thank you, Miss.
Okay, next question, probably, moderator.
Okay, well, thank you. Okay, well, thank you, Ms. Grace and Mr. Shahril. And then we will turn on to the second questioner. So there is Mr. Yusuf Hanafi Lubis. So please, Mr. Yusuf Hanafi Lubis.
Yes, thank you for moderator. Okay, Miss, let me introduce myself. I'm Yusuf Hanafi Lubis. I'm at Faculty of Public Health, UIN Sumatera Utara, Medan. I wanted to ask you, yeah, because if we do diet, we are if I not consumption of carbohydrate, what is a diet is a mostly a good diet or bad? Thank you.
Okay, so you were asking, sorry, the name is Yusuf, yeah?
Yes.
Yusuf asking, what is a healthy diet? So again, it's really simple. A healthy diet is a balanced diet, yeah? So you have a balance, you should have a balanced diet of your carbohydrates, your proteins, and also your fat, yeah? Especially, it's not that because you want to get skinnier, you don't eat certain types of food. So a lot of people nowadays, they follow a certain diets, yeah, because they want to get skinnier. They don't eat carbohydrates, yeah, they just eat proteins, right? A lot of people actually do that. It's actually not a good diet, yeah, according to nutritionists also, because it's not balanced. You still need your carbohydrate, you still need your fat, yeah, and you still need the fruit and vegetables for the micronutrients. So it's a lot of people actually connected that they just eat one types of nutrients. They just eat proteins, they just eat fat sometimes even, yeah. There's a diet called tiger diet, they only eat meats. That's not a really good diet because it's not balanced. So good diet is a diet with balance, carbo, protein, and fat, and also the fruit and vegetable for the micronutrients. And the amount is also have to be in the correct amount, yeah. So it should be sufficient, again, balance, yeah. It's not like over, then you will get obesity, and it's not should be less, then you get malnutrition, yeah. So you can find in the internet what is exactly that you should eat according to your age, yeah, because different age, your good diet is depends on your age, your sex, your gender, yeah, and also your activity. If you have more activity, you will need more food, yeah. But the easiest way is, like I said to Sahrul, is every time you eat, please remember to make your plate colorful, and also have vegetable and fruits in your on your plate, yeah. And don't also forget about practicing physical activity, because it's also part of the balanced diet. The balanced diet guideline is not just about food, but also about how you need to practice healthy lifestyle. Yeah, healthy lifestyle, and also doing a practice physical activity. And also the last part is how you need to monitor your own weight and height. Yeah, so it's not just eating, but also how you do physical activity and you monitor your weight and height. So don't hate the scale, the weight scale, yeah. Go up to the weight scale every morning and monitor your weight. That's also part of practicing a healthy diet, a healthy balanced diet. Yeah, that's some of the tips, practical tips, and I think you can easily follow, Yusuf, yeah. So just make your plate colorful every time you eat. That will be the easiest trick of having a healthy diet. Yeah, except that be careful with the food. Yeah, don't buy the food from a vendor who did not prepare it well, because then you will get diarrhea and stuff like that. Yeah. Okay, I hope that answered your question.
Sorry, I'm sorry, Miss. Can I ask more?
Yeah, maybe one more. Sure.
Can I ask more, Mrs. Grace?
Yeah, sure. Go ahead.
Okay. At rice at convenience in sunrise at the convenience store. What is a good is mostly carbohydrate or low?
Yeah, if you go to, depends on the convenience store, right? If you go to the convenience store, there are processed foods there. You rarely find fresh products there, right? So if it's a processed food, of course, a fresh product is always better than processed food. If it's processed food, you have to look at the label. Yeah, like how many sugars or salt is there, because you have a limit for sugar and salt, daily sugar and salt need. Yeah, so don't excess that. Of course, you have to be smart enough to combine, especially because maybe this is a lot of you are actually anak kos, yeah. Actually, you should be smart enough to combine the food from the convenience store. Maybe you have to read the labels, yeah, and ensure your there is no excess sugar and salt in your daily diet, and buy or eat as much the fresh products. Yeah, if the convenience store sell fruits, or sometimes they sell vegetables or eggs, that could be one of the alternative for you to buy. Yeah, so and if they sell rice, why not buy those rice? Yeah, of can I eat instant noodle? Yeah, sometimes you may, yeah, but not in an excessive amount. Not every time you eat instant noodles. Yeah, maybe if they have other noodle, not the instant one, you buy that one. Yeah, so still in the convenience store, if you're smart, there are some healthy food, but again, if you can buy fresh food, it will be better. Okay, I hope that answer your question, Yusuf.
Miss. So enough. Thank you for your answer.
Thank you. You're welcome.
Okay, well, thank you, Dr. Grace, and thank you for Mr. Yusuf Hanafi. And then we still have 15 minutes for our discussion session. So let's turn on to the third questioner. So please, Mrs. Raihan Melissa Lubis.
Hello, Ma'am Grace.
Hello, Rehan. Should I call you Rehan or Melissa?
Rehan, ma'am.
Rehan, okay.
Okay. My name is Ryan Masulubis from Public Health University, State Islamic University of North Sumatra. I want to ask a question, ma'am. As we know, the habit of eating food in each region in Indonesia is different, and each region has traditional food that are the staple food in the region.
Yes.
For example, the habit of eating fatty food with coconut milk in the West Sumatra. So how to overcome food habits so that disease doesn't arise from this food. Moreover, the food is a staple food in the region. How to educate the public so that they can process their food well. That's it, ma'am. Thank you.
Yeah. Thank you for your question, Rehan. Yeah, so actually we are encouraging people to eat local food as much as possible. Yeah, but the definition of local food that we already established is actually local food is not indigenous. Yeah, it's not always traditional food. Yeah, local food is the available food in your region. That's your local food. Yeah, because people are changing now. Like if, for example, like tempe. Yeah, tempe is a traditional food in Java, but a lot of people in other region in Indonesia nowadays they also eat tempe and also tahu, which is fine. Yeah, tempe and tahu already become a local food there because it's available, it's cheap, and it's also have a lot of proteins. Yeah, so you can actually eat that. But you can also combine with the local wisdom on how you cook the tempe and the tahu, right? So I think in West Sumatra, people use a lot of coconut milk, yeah, heavy in coconut milk. That's okay, yeah, that's the culture there, and we should preserve that. But then the issue is how much they use it, yeah, and how they prepare the coconut milk, yeah, and also a lot of Indonesia, not just in Indonesia, most of the Southeast Asian like fried food, yeah, gorengan is our religion, yeah, religious food, yeah, our convenience food. Is gorengan bad? No. If you can prepare the gorengan well, yeah, you use the new oil. You don't use use oil very much, and then you eat it in the correct amount, not much, not just eating gorengan the whole day, yeah, but just that gorengan is a snack, so use it as a snack. It will be fine. If it balanced, it's okay. So it's not. And how to educate people? Yeah. So again, like our Ministry of Health have several balance guideline. They already have several balance guideline. Ya. Jadi the balance guideline, the tumpeng, gizi seimbang, and also piring makanku. That's the two most easiest way of educating other people on what they should eat per day and what should they eat per meal. Yeah, piring makanku is per meal. If we can just tell people, just eat like this piring makanku, and then it will be okay. And besides then education, I think you also have to practice what you educate. You also have to give example. Yeah, so you know that the good the balanced diet guideline, how many carbohydrates you need to eat per day, how many protein, fat, how many sugar, salt you have to eat per day, how many in terms of spoon. Yeah, you know that those guidelines, practice it yourself first and then teach others. Yeah, because it will be easier. People will see that, oh, you follow the guideline, you walk the talk. Yeah, they will follow you. And then you as a young generation, you're, as my presentation show, the social media put a lot of influence in people, yeah, in helping their diet. So that could be used also. Give education about healthy food, the one that you found out from your teachers at school, your lecturers. Put it in TikTok, put it in Instagram. That will help educate people. Yeah. If you take picture of the food that you're eating, I don't know whether your generation still do that. My generation did that. Take the good the piring makanku shape, yeah. That will also help educate the people. That's small things that you can do daily, I think.
Thank you for your answer, ma'am.
Yeah.
Well, thank you.
Give back to moderator. Hello, moderator. Can I already have Yuliawati here. Maybe she can just give her question. If you may, Yulia.
Okay, Dr. Grace, thank you very much. Good afternoon, nice to meet you, Dr. Grace Wangge. My name is Yuliawati Anggreni Siregar. I am a third student public health from Islamic State University of North Sumatra. So my question is, as a public health worker, what can we do to improve food access and healthy dietary habits in coastal communities, and what is the most deter people from following a healthy dietary habit during this pandemic? Thank you so much.
Okay, can you repeat the last question? What is
the most deter people from following a healthy diet?
What is the most deter?
Deter people from following a healthy dietary habits during this pandemic.
Or what is the determining factors, you mean?
Yeah.
Okay,
Yes,
so the first question is about the coastal people, right? How are we going to increase their access to food and also their habit? Of course, education is always one of the way. Yeah, so you have to give them education about the balanced nutrition. But then I agree, the coastal people probably have difficulty in accessing some healthy food, especially fruit and vegetables, yeah, because they live in the coastal area. They really depends on the people from the valleys or mountains for the fruits and vegetables. In terms of access, as a public health practitioners, we cannot work alone. We have to collaborate with other stakeholders. Yeah, so public health people what can they do? What we can do, because I'm also a public health practitioner, we can advocate the stakeholders. We can advocate the community leader, the head of the village, for examples, of like how they can mobilize or they can increase the access to fresh products, to fruit and vegetables, because that is something that cannot be handled by the people themselves, right? If we educate coastal people, you have to eat fruit and vegetables, but the fruit and vegetables is not there, then it will be useless, right? We give them knowledge, but we don't give them the things to practice. Yeah. So aside than educating the people, we have to also educating the leaders. Yeah, the bupati, the not just the help of the head of the puskesmas, the especially the bupati, and also maybe the head of the regency, who has more power in allocating their resources for food access. Yeah, bupati have a lot of funding and power to do that. So really, if you can, talk to them, educate them in a more polite way, give them, if they're going to for the election, it's a very good time to ask them, oh, Pak Bupati, if you want to win, you have to have this healthy program. That could be one of the example. Yeah, so you advocate the leader in terms of access, because access is really determined by the government. Yes, it's not something that each people, it's not really the responsible of each individual. That should be helped there. That's for the coastal, the first question. The second question is, what is the determining factors? From our research, we see that, of course, your level of education is really a determining factor. Your employment status, and also your peers, your family. If your peers, your environment have a good, healthy habit, you will follow it. You will tend to follow it. So environment is also important, but also your knowledge and your, of course, if you have money, you can buy you can choose which food they're going to buy. And unfortunately, in Indonesia, sometimes fruit and vegetables are still expensive, so you need some money to buy it more than other food, yeah, rather than carbohydrates. Yeah, that's what we found in our study. I hope I answered all your questions.
Yes, ma'am. Thank you very much for the useful and amazing explanation. Thank you very much. Good afternoon.
You're welcome, Julia.
Okay, well, thank you, Dr. Grace and Mrs. Yuliawati. So it means Mrs. Yuliawati Anggreni was the last questioner. So I'm very sorry for not being able to invite all of you who want to ask, because our time is limited. So before I close this discussion session, I want to conclude the discussions. So there seems to be a difference in the pattern of food nutrition early in the pandemic and after pandemic, such as like food safety, and then determinants of health, and then diet, and then coping strategy about food nutrition, and then also food shopping, food accessibility, and etc. So because of that, we must aware about this different pattern of food nutrition early pandemic and 1 year after pandemic. So, and then from the questions for all the participants, so there have been many inputs from Dr. Grace for how to regulate our diet so that is balanced. So that for that, I hope we can implement it. Okay, thank you very much for your attention. For Dr. Grace, thank you very much for sharing with us. We know you are a busy person, so thank you for taking time to come here. We hope we will see you again in other discussions.
Yeah, thank you so much for inviting me. Hope next time I can visit Medan, and have a good lunch. Remember to look at the color of your food.
Okay, well, Dr. Grace, before we close this discussion, so we will take a photo session first, okay? Okay, for ladies and gentlemen, please open your camera so the committee will take photo for us. Okay, ready? Okay. 1, 2, 3, and smile. Okay, once more. 1, 2, 3, smile. Okay, it's done. Thank you very much, Dr. Grace Wange, and thank you very much for all the participants who active to this discussion. Okay, see you, Dr. Grace. Okay, thank you very much for all participants and for our presenters. So it means our third discussion session have done, and then I will close this discussion session. I'm Citra Cahyati Nasution SKM. Please forgive me if there is any mistake for me when I am monitoring this discussion session. So see you later. Bye bye. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Right.
Nanti aja.
To our MC, please. Floor is yours.
Hancur ya. Jangan jebol baskomnya.
First of all, thank you so much for all the speakers. Thank you so much for Mrs. Raihan and the Alpha FKM PhD. And thank you so much for Mr. Jericho Cardosi PhD. And thank you so much for Dr. Grace Wange PhD. Thank you so much for everyone and insightful and dynamic conference. And ladies and gentlemen, don't forget the leaders we have for the participate in our opening ceremony.
Tampil nih, Janis, bawa nih.
And coming up to the last session, we are going to have our session. Now we have a lot of very time, and please note that our session will start at 2 p.m. So you can prepare your session to listen in this afternoon.
Ya Allah.
To all participants, please note that we will come back at 2 p.m. Will be there will be 4 rooms in this link of Zoom. The first room will be present and moderatory by Mrs. Zata Isma MKM with topic health behavior, epidemiology, and public health. And in the second room, moderatory by Mrs. Florina Aida MKS with topic health behavior, epidemiology, and public health. And the third room, moderatory by Mrs. Fitriani Pramita MKS with topic environment, occupational health, nutrition, health policy, and health management. And the fourth room, moderatory by Mrs. Delfren Ayu Sembiring MKes, with topic environment, occupational health, nutrition, and health policy. Please, for the participant, come back at 2 p.m. because we start parallel session. There will be more presenter that present their paper.
And thank you so much for your for all speakers and exhibitors. Thank you. I will be back at 2 p.m. So,
That's for us. That's from us. See you. Assalamualaikum warahmatullahi wabarakatuh.
Kalau satu-satunya anggota keluarga yang bisa dan mau terus menghadapi
siswa nggak pasti baca itu orang bahasa Inggris
Helikopter, helikopter.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Come back with us as a master of ceremony in this conference with me, Madhuri Sakila, and my partner.
And now will be in the end of the conference. There will be forum for its discussion. For all of participants, please join every its room. In the room number 1, coordinate with Mrs. Wasiam MSE and moderatory by Mrs. Zata Isma MKM. The presenter Ardini Syahlini, the second presenter Yusuf Hanafi Lubis, Adela Dwi Puspita Siregar, Raisa Adila, and Arafi. In the second room, coordinated by Mrs. Eliska MKes, moderatory by Mrs. Zurina Aida MKes. Presenter Nada Muhizra Situmia, Rahayu Sakinah Pasaribu, Novi Aulia Arif Rahman.
And in the third room, the topic is environment, occupational health, nutrition, health policy, and health management. The coordinator is Dr. Novi Susanti MKes, and the moderator is Mrs. Fitriana Pramita MKes. And the participants are Mutiara Husna Sari Dewi, Safira Hanum Derani, Renpal Falevi, and Ririn Audiamuki. And the last room, the coordinate by Mrs. Mutiananda MKes and the moderator by Mrs. Delfriana Ayu Sembiring MKes. The participants are Zikra Maya Ulfa, Hari Syahputra, Miftahul Husna, Kurnia Amalia, and Dewi Yanti.
Apa maksud ini? Kok dibagi-bagi ruangannya?
And the conference will continue by be continued by every moderator in each room. Just that's from us. Assalamualaikum warahmatullahi wabarakatuh.
Bukan loh, kok terlalu cinta kali sama si Yusuf.
Untuk teman-teman yang nggak bisa bergabung ke room breakout, bisa menambahkan room di awal namanya. Ya udah. Pada setiap peserta dan partisipan, silakan bergabung ke room masing-masing. Diskusi akan segera dimulai. Untuk teman-teman yang belum bisa bergabung atau tidak bisa bergabung ke breakout room, bisa menambahkan room di awal namanya. Jadi room 1 atau room 2, room 3, room 4, kemudian dilanjutkan dengan namanya. Selanjutnya operator akan memasukkan teman-teman ke room yang dituju.
Sekali lagi kepada seluruh partisipan dan juga peserta diharapkan untuk mengubah nama Zoom dengan format yang telah ditentukan, yaitu room 1, 2, 3, atau 4 underscore nama lengkap. Kemudian operator akan memasukkan setiap partisipan ataupun presenter ke dalam room yang telah dituju. Sekali lagi diberitahukan kepada seluruh partisipan dan juga peserta untuk mengubah nama Zoom menjadi room 1, 2, 3, atau 4 underscore nama lengkap, dan kemudian operator akan memasukkan setiap peserta dan juga presenter ke dalam room yang dituju. Terima kasih.
Room 1 itu.
Baik, mohon perhatian untuk memudahkan memilih room sesuai dengan peminatan topik masing-masing. Saya ulangi, untuk room yang pertama yaitu presentasi dengan tema Health Behavior, Epidemiology, dan Public Health yang akan dikoordinator oleh Ibu Wasim MSI dengan peserta presentasi yaitu Ardini Syahrini, Yusuf Hanafi Lubis, Adela Dwi Puspita Siregar, Anggi Yohana Nasution, Raisah Adila, dan juga Arafi Insani. Kemudian selanjutnya untuk room 2, topik yang dibahas yaitu mengenai Health Behavior, Epidemiology, Public Health yang akan dikoordinator oleh Ibu Eliska Mkes dengan peserta presentasi yaitu Nada Muhizra Situmeang, Fenicia Andriani Saragi, Rahayu Sakinah Pasaribu, Novi Aulia, dan kemudian Aulia Arif Rahman. Saya lanjutkan, kemudian untuk room yang ketiga, topik yang akan dibahas yaitu mengenai environment, occupational health, nutrition, health policy, and health management dengan koordinator yaitu Dr. Novi Susanti Mkes. Dan presenter yang akan mempresentasikan yaitu Mutiara Husna Sari Dewi, Safira Hanum, Derani, Renval Valevi, dan juga Ririn Audiamuki. Dan yang terakhir yaitu pada room 4, topik yang saya ulangi, pada room 4, topik yang akan diangkat yaitu mengenai environment, occupational health, nutrition, dan health policy. Dengan koordinator yaitu Ibu Mutiananda Mkes, dan presenter yang akan mempresentasikan yaitu Zikra Maya Ulfa, Haris Syaputra, Miftahul Husna, Kurnia Amalia, dan Dewi Yanti. Dihimbau sekali lagi kepada seluruh presenter dan juga partisipan untuk segera mengubah nama Zoom untuk merename dengan format yang telah ditentukan yaitu room 1, 2, 3, atau 4 sesuai dengan room yang dituju, kemudian underscore nama lengkap, dan kemudian operator kami akan segera memasukkan presenter dan juga partisipan ke dalam room yang telah dituju. Terima kasih.
Pada seluruh peserta dihimbau untuk mengganti nama, menggunakan awal namanya itu menunjukkan room yang akan dituju, sehingga operator dapat memasukkan teman-teman ke room yang ingin teman-teman lihat presentasinya. Untuk teman-teman yang tidak mengganti nama, maka kami akan memasukkan teman-teman ke room masing-masing yang saya pilih secara acak atau ke room yang paling sedikit audiensnya.
Opsi.
Apa rumah kucingnya mengantar ke situ? Ya, udah Kak, dari kucing. Apa belum ngerti? No. Iya, tadi pagi agak mendung ya kan? And the last is influencing students to remember important information of technology. Persepsi dengan kepatuhan membayar iuran, persepsi rendah kurangnya sekitar 2.000. Bukan 2.000. Tapi ini dengan ini lawak. Yang Wak tadi nanya sama Wak apa? Ingatkan dia gitu. Betulnya berapa punya Wak? Ya, katanya kata Wak. Berapa pokoknya? Pak, lebarnya panjang juga. Sama juga. Apa? Ini jadi kalau buat jual itu ini adalah loh. Ya, tapi tadi itu kalau uang udah lah, saya bisa berkali. Iya, itu sangat. Tapi katanya apa? Tadi nanti kalau nanti saya tidak Iya. Karena nggak usah pindah.
Untuk teman-teman yang masih ada di main room, silakan masuk ke breakout room, bisa dipilih langsung. Kalau di handphone dia ada di layar teman-teman, ada breakout rooms namanya. Ada dia 4 pilihan, silahkan bergabung.
Ya. Kasih telurnya tampilan sawi putihnya telurnya sedikit aja. Cabai, bawang, diiris-iris, kuahnya dicokok, kasih merica sedikit. Bawangnya agak cepat. Iya, sama Bu. Kenapa ada lo? Kenapa ada lo? Alhamdulillah ya. Celana pendek sih itu mah. Coba.
Para teman-teman yang masih di session, silakan join breakout room. Kalau teman-teman menggunakan handphone, itu di layar teman-teman ada di sebelah kiri kotak 4 join break room, tinggal klik itu, terus pilih room yang akan dituju. Ada 4 room masing-masing yang tadi sudah dibacakan. Nggak bisa, kenapa ya? Nama para
Oh ya.
Silahkan dicoba lagi teman-teman, apakah masih tidak bisa?
Mama sih, saya rasakan apa yang dirasakan.
Ya Nabi, Ya Muhammad.
Untuk beberapa teman-teman yang belum bisa join ke backroom, beberapa yang lain itu bisa kemungkinan belum menjadi join adalah karena aplikasi Zoom-nya belum update ke versi yang terbaru. Karena breakout ada ini fitur terbaru, jadi mungkin terganggu karena teman-teman diharapkan update dulu atau menggunakan device yang lebih update. Jadi dimungkinkan teman-teman tidak bisa bergabung ke room breakout karena aplikasi Zoom teman-teman belum terupdate ke versi yang terbaru. Jadi diharapkan teman-teman untuk update Zoom-nya segera, kemudian kembali join agar dapat digabungkan atau dimasukkan ke room presentasi.
Oh iya iya. Karena banyak, karena teknologi kita sudah
Saya sudah bergabung Bu pakai HP. Sebentar ya Bu. Oh my God.
ya penelitian terakhir ini untuk diabetes ya. Nah itu menang itu masuk TV ya, ada orang yang mencari itu kemarin juga dia FKM
Oh my God. Sudah Bu.
dia lagi
Kalau sekarang udah ada ya Bu?
belum masuk Anggi, belum ada suaranya.
Aduh.
Anggi di mana posisinya? Halo?
Iya Bu.
Coba Anggi nggak usah pakai headset Anggi. Headsetnya mau masalah.
Udah.
Udah, masih nggak masuk suaranya.
Sekarang udah terdengar ya Bu? Aduh ya Allah, bingung kali aku nih.
Anggi silakan breakout room satunya dulu Anggi.
mati ini.
Bapak Ibu, silakan pencet breakout rooms yang ada di samping untuk pengalihan ruangan. Di room 1 kah, di room 2, room 3, atau room 4. Ya, sekali lagi coba pilih di breakout room-nya ya. Terima kasih.
Bang.
Ih, nggak bisa audionya.
Andai rasa di hati tak sedalam.
Udah terdengar ya, Bu? Sudah terdengar, Bu?
Anggi
Halo?
bukan di ruangan ini, Anggi. Anggi salah ruangan. Anggi pilih ruangannya, Anggi di breakout room-nya, Anggi.
Suaranya pelan-pelan, Kak. Saya sudah coba masuk ke room 1 tapi selalu teralih ke room yang ini, Bu. Jadi saya juga bingung.
Oh ya. Ya, bentar ya, kita coba cek lagi ya.
Ada masalah ya? Tidak apa-apa. Aja, nggak apa-apa ya. Papernya sudah kita terima, nanti kita share aja kepada peserta untuk membaca. Mungkin bisa kontak Anggi jika ada yang ingin bertanya ya kepada Anggi. Kita akan share kontaknya aja pada adik-adik. Kebetulan Anggi banyak analisis paper masing-masing. Mungkin nanti ada banyak yang bertanya pada Anggi. Ya siap-siap ya Anggi ya.
Iya, Bu.
Oke, baik. Saya rasa sudah cukup pertemuan kita teman-teman pada hari ini. Luar biasa dan dari teman sekalian ada 100 kajian dari 1 ya. Saya ucapkan terima kasih, semoga mendapatkan banyak ilmu yang sudah presentasi. Saya ucapkan terima kasih kepada teman-teman yang sudah luar biasa sekali memberikan ilmunya. Mudah-mudahan ke depan ini membuat kalian punya jam yang lebih tinggi lagi ya di luar. Akhiri pertemuan kita. Majelis. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Dipersilakan untuk kembali ke depan ya. Progress.
Apa nih? Kalian tuh sampai mana lah coba?
Jauh lah jangan itu.
Masih jauh lagi tuh.
Setengah jam lagi lah, setengah jam.
Jangan lamaan lah kalian ya.
Kami udah sampai tidur siang kami kampret.
Mohon maaf ya, kita lagi di room. Mohon maaf ya, cakapnya tolong dijaga ya, jaga etikanya ya. Tolong ya, jaga etikanya ya. Ibu lagi hubungin Bu Jata. Kita masih menunggu ya, roomnya Bu Ulfa ya. Room Bu Ulfa ya, masih menunggu. Bu Zata, bagaimana roomnya Bu Ulfa? Room 2 sudah selesai? Apa juga jam segini? Setengah jam, 1 jam. Habis sholat tidur belum maghrib.
To all participants, we are waiting the azan to finish, and then we closing the conference with Dean of Faculty of Public Health, Mr. Professor Dr. Syafruddin MPD, closing speech.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone.
Waalaikumsalam warahmatullahi wabarakatuh.
So we are reached the end of the conference. After the discussion with forum has finished.
And the session in this conference is closing by the Faculty of Public Health, Mr. Professor Dr. Syafruddin MPD. With honors, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Alhamdulillahilladzi hadana wa ma kunna linahtadiya laula an hadana Allah. Asyhadu an la ilaha illallah wahdahu la syarikalah wa asyhadu anna Muhammadan abduhu wa rasuluh allazi la nabiyya ba'da. Amma ba'du. Yang sama kita hormati Wakil Dekan 1 Bapak Dr. Muhammad Furkom MKom Sains, Wakil Dekan 2 Bapak Dr. Watni Marpaung MA, Ketua Program Studi, Sekretaris Prodi, kemudian Kasubag Akademik Kemahasiswaan, Kasubag Umum dan Keuangan, serta rekan-rekan sejawat para dosen, para partisipan, presenter maupun mahasiswa hadirin berbahagia. Puji syukur kita persembahkan kehadirat Allah SWT bahwa sore hari ini kita masih sehat, sudah mengikuti rangkaian kegiatan dari konferensi internasional yang membahas tentang Triple Burden Diseases and Pandemic COVID-19 Challenge and Opportunity. Alhamdulillah semua pembicara baik dari Australia, pun Jakarta maupun UI sudah berpartisipasi untuk kegiatan ini, memberikan pokok-pokok pikiran, pengembangan teori maupun saran-saran untuk membangun kesiapan kita dalam menghadapi beban berat ya dari dampak COVID-19 baik dalam bidang pendidikan, pemerintahan, bisnis, perdagangan, keagamaan maupun kehidupan sosial kita selama ini atau lebih kurang 2 tahun. Paling tidak ilmu kesehatan masyarakat yang basisnya ada pada FKM mampu memberikan solusi, ya, solusi yang inovatif dan kreatif untuk mencegah munculnya beban berat yang ketiga, yaitu pada saat bersamaan di tahun kedua ini, sudah 3 tahun maksud saya, COVID-19 ini, kita juga masih menghadapi beban berat, ya, terkait dengan masih kuatnya penyebaran atau perkembangan penyakit tidak menular atau penyakit-penyakit ikutan yang ditumbuh kembangkan akibat COVID-19 ini, serta penyakit-penyakit lainnya. Oleh karena itu, gagasan tentang bagaimana mengubah pandangan masyarakat tentang vaksin, ya, yang sebagian masih menganggap vaksin itu berbahaya atau merupakan menghambat, ya, kelangsungan hidup manusia. Nah, dari hasil penelitian tadi kita lihat bahwa harus ada jurus-jurus komunikasi yang efektif kepada umat atau kepada masyarakat dan bangsa, bagaimana upaya-upaya pencegahan supaya dampak COVID-19 ini tidak berkembang pada bidang-bidang yang lain lagi atau muncul gelombang ketiga sebagaimana yang diperkirakan para pakar. Lebih dari itu tentu saja penelitian-penelitian FKM memberikan kontribusi bagi kita untuk mencegah munculnya penyakit ikutan dari perkembangan COVID-19 ini. Maka perguruan tinggi menurut saya adalah wadah yang paling strategis untuk mengembangkan model-model komunikasi, ya, tentang komunikasi kesehatan, promosi kesehatan, ya, yang bisa mencegah munculnya penyakit ikutan dari berkembangnya atau pandemi COVID-19 ini. Terima kasih kepada seluruh pihak, terutama narasumber, presenter, panitia, rekan-rekan dosen, akademisi maupun mahasiswa atau alumni yang sudah berkontribusi terhadap suksesnya kegiatan konferensi internasional kita di tahun ini. Mudah-mudahan tahun depan kita akan mengembangkan konferensi lain yang memungkinkan kita bisa meningkatkan, ya, kualitas atau level FKM UIN Sumatera Utara Medan sejajar atau melampaui FKM yang lebih tua, ya, atau paling tidak bekerja sama untuk maju bersama, ya, dalam konteks perkembangan masyarakat, kalaupun 4.0 atau 5.0 yang semakin berubah cepat dalam mengembangkan ilmu-ilmu pengetahuan yang berbasis kepada kesehatan masyarakat. Saya kira ini sambutan saya. Sekali lagi terima kasih kepada semua pihak, kepada presenter yang sudah sangat serius saya lihat dari 4 ruang, ya, mempresentasikan, mendiskusikan hasil penelitian atau gagasan-gagasan kreatifnya, ya, untuk konferensi FKM di tahun 2021. Terima kasih. Sekali lagi, mari kita berserah diri kepada Allah Subhanahu wa Ta'ala bahwa kegiatan kita hari ini semuanya berada dalam ridhonya dan diberikannya kepada kita kesehatan untuk bisa melanjutkan kiprah dan pengabdian kita di hari-hari raya esok, apalagi sementara kita memasuki tahun 2022. Mudah-mudahan kita sampai ke sana dan bisa tetap beraktivitas dalam dunia ilmu pengetahuan dan teknologi untuk, ya, mengubah keadaan masyarakat kita, bangsa kita, umat kita kepada yang lebih baik. Kita harus tetap waspada, jangan sampai lengah, ya, jangan sampai abai terhadap pencegahan COVID-19 ini, ya. Karena saya tengok tadi di koran waspada masih, ya, kita harus diingatkan tetap menjaga protokol kesehatan dan menjaga kesadaran diri keluarga dan masyarakat. Akhirul kalam, kita tutup acara konferensi internasional tentang the triple burden disease and pandemic COVID-19 challenge and opportunity dengan bacakan hamdalah alhamdulillahirabbil alamin. Akhirul kalam, assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you to Dean of Faculty of Public Health, Professor Dr. Syafruddin MPD. And with that speech posing from Dean of Faculty of Public Health, this is the end of this conference. But first, we want to say thanks to Rector of State Islamic University of North Sumatera, Professor Dr. Syahin Harhab MA, Dean of Faculty of Public Health, Professor Dr. Syafruddin MPD, and the Vice Dean, Mr. Dr. Muhammad Furqan SSIM SC, at the same time as Head of Committee in this conference, Mr. Dr. Watnimar Paung MA and Mr. Dr. Salamuddin MA. We also say thank you to Head of Department of Public Health, Mrs. Susilawati FKM MKes, and the Secretary, Dr. Novi Susanti MKes, and all of our lecturers in the State Islamic University of North Sumatera, and all of the participants and presenters.
And we will also thank you so much for the speakers, Mrs. Raihana Nadra Alkaf, FKM PhD. And thank you so much for Mr. Jericho Pardozi, PhD. And last but not least, thank you so much for Dr. Grace Wange, MD, MSc, PhD. Thank you so much for all the participants for your attention in this conference.
Baik, kita tutup konferensi ini dengan mengucap doa kafaratul majelis. Subhanakallah wa bihamdika asyhadu alla ilaha illa anta astaghfiruka wa atubu ilaik. Baik, kami berdua pamit undur diri. Saya Zulfikar Abdul Aziz
dan saya Marwi Saklam. Mohon maaf yang sebesar-besarnya apabila ada kekurangan dan kesalahan selama acara konferensi ini berlangsung. Semoga kita dapat bertemu di lain waktu. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.